FDA has issued a Form 483 to Aurobindo's Unit 4, and we have received 9 observations. We already knew that there are observations, but the details of the observations plus the number was what came out a couple of days ago. To talk more about this, we have Surajit Pal of Prabhudas Lilladher. Surajit, what's your view? Do you think that Aurobindo can get out of this, and do you expect a possible delay in terms of approvals, if not an escalation?
First of all, I think observations are, not very serious in nature. They're very much, as management said, is a procedural. So I think those, addressing them does not require any data generation. As a result of it, I think it would be easier to address them and get the resolution in, say, by FY19. Let's not put it 4, 6 or 8, whatever. But I think in near to medium term, they could achieve the, resolution. There is a big possibility. Second point is that their observation 9, I think it is, if you see their earlier resolution achieved, is the same issues in terms of updating master data sheet by the similar number of people. What I understood earlier is that there was a dummy interface created where all the guys putting data and the only authorized person ratified those data and put it in master sheet. I think management must, those putting those resolution earlier, I think there is some mistakes happening. Third point, if you can notice, these observations are not by the investigator, it is by the generalist. She is chemist or biologist. So if you go by the language and the observations, so from that importance point, if it has been from investigator, I think importance would have been much, much higher. Okay. As far as approval is concerned, I think approval is most likely will not be stopped. So given this kind of observation, I think approval will not be hampered given their timeline, whatever they have.
Okay, so what are the kind of approvals that they are expecting from Unit 4? Can you quantify that for us? And what is the timeline for approval so we can gauge whether or not they'll receive those approvals by that particular timeline?
I think currently they have 45 pending, and this year I think they're definitely expecting 10 plus kind of injectable approval from Unit 4 itself, other than the key product like Artepenem from their Rajasthan plant, Penem plant. So and a few of them from Unit 12, which is also due for CGMP visit in say next month or 2. So I think definitely they are expecting good, and they and I believe that they will get it.
Okay, and Surajit, we'll end this conversation with you. So no DI and no repeat observation. So you expect a possible EIR or maybe an approval, which I think would be probably more indicative of the facility being cleared, probably in terms of the next 6 to 12 months. What is the timeline you're working with?
I think next 6 months they will definitely. I mean, there is a bigger possibility that they will receive EIR on that.
Okay, so in the next 6 months.
Yes.
Okay. All right, Surajit as well as Cinderella, we'll leave it on that note. Thanks very much for joining in and talking to us. So that is the word coming in from Prabhudas Lilladher as well as Daulat Capital, that maybe the response would be important, but we could probably expect an EIR for this particular unit for Aurobindo in the next 6 months. No estimates have been changed as of now.